Now let's take a look at the South African Medical Association trade union, which has challenged the Department of Health to do more in placing skilled unemployed medical workers in the job market. The union cites over 800 qualified doctors are unemployed following the completion of all requirements. The union says the concerns are underscored by loss of valuable medical and understaffed hospitals amidst a surplus of ready and willing medical practitioners. For more on this, we are talking to Dr. Molotsi, and joining us as well, we will also be joining Dr. Bayeni. But first, let's talk to Dr. Molotsi, a qualified medical doctor who is currently unemployed. We understand that Mr. Molotsi, Dr. Molotsi, you are unemployed and in South Africa, despite the shortages of doctors in the country. How do you feel about this?
Good morning and good morning to your viewers. I'm Dr. Molotsi. Well, the issue of unemployment, especially amongst youth, I would say is one very painful experience. So right now, I think most of us are feeling very anxious, feeling hopeless because of the multitudes of problems that we are facing individually, our families that are also facing, and also thinking about this, the larger community who is at need of more doctors, since there's a very huge crisis in the public healthcare sector.
Dr. Molotsi, just to hold on this conversation, let's try and paint a picture to our viewers. Let's view this link that's coming up now.
Mahikeng, the capital city of the Northwest Province, one would assume that living here would come with the convenience of easy access to specialist doctors, even at public health facilities. But that does not seem to be the case. Some of the patients at this facility say they have to travel more than 300 kilometers to get medical help. One of them is Penyo Isaac, who has been partially deaf since 2010 after suffering a stroke at the tender age of 13. He says in the past 3 weeks, he has traveled to the Mafikeng Provincial Hospital 10 times without seeing an ear specialist. He has since been referred to a facility 200 kilometers away.
In the Mafikeng, the hospital of Mafikeng, we have a shortage of specialist doctors. And then the shortage because some new ENT is not at Mafikeng Hospital, is far away from Mafikeng Hospital at Klerksdorp Hospital. And then Klerksdorp Hospital is far away from Mafikeng to Klerksdorp. It's 200 kilos.
64-year-old Ellen Manonyane is another patient at the receiving end of the shortage. She constantly travels outside the province to see an orthopedic specialist. She described the journey as tedious.
We struggle to get specialists. We are tired of being transferred back and forth to Tshepong and Baragwanath Hospital. I now have a serious bone illness and they only gave me pills. If there were specialists, they would have attended to my problems speedily. We really need specialists in Northwest.
Meanwhile, the Northwest Department of Health says getting specialist doctors has proven to be no easy task.
Doctors who are specializing, they are few in the country, that's number one. And if they are few, it means they weigh their options. A rural province like Northwest, they will always say, is it best for me to be in Sandton, working in nice environment, or should I go into a rural area? So most of the time they will choose not to go to the rural area. And that is why when we train, we recruit learners from historical disadvantaged rural areas, where they're thinking that when they come back, they will know that I left a gap back home where I come from. I need to go back and work there.
Some organizations in the health sector say various factors have led to this countrywide crisis.
Last year, 21,000 specialist medical personnel posts which are vacant across all 9 provinces. And there's multiple reasons why we see this. But the critical shortage was created by incompetence as well as poor governance from the various provincial departments of health. And there's an unwillingness to address these serious concerns. Provinces must make sure that there is no political interference in the daily workings of these doctors and specialists.
The Health Department has been urged to strengthen its leadership and governance across the country. Selwane Khachau, SABC News, Mahikeng.
Dr. Molotsi, just to come back to you with our conversation, when did you finish your community service and how long have you been unemployed?
I finished my community service on the 31st of December last year, which is 2023. And as since then, up to now, I've been unemployed. But I've got an understanding that there have been a couple of us who've been unemployed since mid-year last year and who've been waiting for employment.
So have you contacted the Department of Health about this and what's their response?
Pardon me?
Have you ever contacted the Department of Health about this and what's their response?
Well, before even the end of our community service, I have tried to contact the Department of Health in my province with via email, but with no response as such. Then I think on the around the 23rd of December, then we received a communique addressed to HODs, CEOs, and to bursary holders that the province does not have budget to employ and that it will be releasing its bursary holders.
Dr. Molotsi, we understand that some doctors are not willing to work in rural areas. That's why they remain unemployed. Maybe if you can just explain to us, is this the case with you?
I honestly dispute those. I don't think there is actually fact to that. If there are any doctors who are unwilling to work in public in rural areas, it would be a very minute amount of us. I am very glad to work in rural areas. Actually, I was working in a rural area just last year. In the past 3 years during my internship and during my community service. And it is a very great pleasure to be of use, to be of help to people who are very close to us, because people in rural areas are people who come from the very same background as us.
Dr. Molotsi, can you please just hold it right there? I'll come back to you. I just want to quickly go to Dr. Luvuyo to respond and clarify the matter, who is a Chief Director for Human Resources at the Department of Health. Hi, Dr. Bayeni, and welcome to Pitso here on SABC Lehae, and thanks for joining us. Firstly, is it true that there are about 800 qualified doctors who are unemployed?
Thank you very much, Pitso, and we welcome and appreciate the opportunity to come and clarify the position of the department, and greetings to the colleague Tapelo. Firstly, let's confirm that in terms of our records, the group that has just qualified, including Tapelo, is sitting at 694. Those are the people that have completed the community service as at the end of December 2023. And so for us, we have verified that in terms of the list of 800, we can account and agree that 694 of those are the group that have qualified now. But also what we would like to share and maybe clarify is that there is compulsory statutory requirements of the 2 years internship and 1 year community service. And thereafter, the graduates or the medical professionals are then referred to as independent practitioners as per their HPCSA registration, which therefore means that they are now allowed to then look for employment opportunities of their choice. And by that we mean others can pursue academia, others can pursue private, others can even pursue public health. Of course, we do want the Department of Health to be the employer of choice, so we would appreciate that they consider us as well. But in principle, when they complete their community service, they then become independent practitioners who will then be looking or seeking employment in the marketplace like any other category of potential job seekers.
Dr. Bayeni, you mentioned a number of 694. So I just wanted to ask you, are there some people who were in the group, same as Dr. Tapelo, who you can assure that are going to be employed this year?
Well, of course, we are still making sure that we do recruit. I can confirm to you that there are provincial adverts that have been out. This week, Monday, we saw one of the adverts that was issued by Free State Department of Health of 60 posts that had closed on Monday. We also have got a confirmation from Mpumalanga that they have got adverts that have been out from October to a maximum of 43 that are going to be ending. There is one that is ending on the 12th of January. There is one that is going to be ending at the end of February. So there are adverts from different provinces that have been out. We also can confirm that Western Cape has confirmed to have about 40 posts that are due to be advertised for this current financial year. But what we would also like to bring to the attention of the listeners as well as our unemployed graduates or medical graduates is that we work as government in terms of financial years. And you would understand that when we talk of January to March, it is a quarter that is ending the current financial year, which will therefore mean that the provincial planning and budgeting cycle had started around April in terms of looking for the posts that will be available for funding as well as advertising and to fill in this financial year. So most of the provinces are, of course, mindful that there are graduates that have completed ComServe and would like to make sure that they do buy or source those services in terms of the recruitment. But of course, the financial year budgeting and the posts that are available might sound as if they are minute now. When we talk of 60, we talk of 40, we talk of 43, but the reality is that there are processes that are already starting in provinces to plan and budget for the coming financial year. That will also see the departments trying to recruit not only medical practitioners, but also other health practitioners that would add value to the service that we render in the public service.
Dr. Bayeni, looking at South Africa, it has a shortage of medical doctors and we have so many unemployed doctors. What are the contributing factors to this? What seems to be more difficult about placing them?
Well, I think one of it is what I've just mentioned in terms of our cycle and planning. Where we would have planned for this financial year and how we would capacitate. But also we should also make sure that we make the public understand as well that the statutory posts of the community service, there we are not budging in terms of ensuring that there is a constant placement and appointments in terms of those. So where Dr. Tapelo was working, for instance, we had made an effort to make sure that there is a community service doctor that will continue with the service that he was rendering. Of course, we want to improve the healthcare services, including where there is a need and posts available for more doctors, we do recruit those. But we are making sure that there is a balance between the two of ensuring that where he was working and the services that he was rendering, they don't get disrupted because he has completed his community services, but that service continues with a placement of another community services that will be in the same position like him to make sure that they render services there. But of course, we would like to see a situation where we become an employer of choice, but we also encourage that the qualified medical doctors also do become considerate and apply when these posts are advertised. They do go and test the market because all of them would be treated equally so. I know that there was a previous experience of a wrong perception of absorption, which is not a legal or an official term in terms of the public health, public sector. So now they have to go through the recruitment processes as prescribed in the Labor Relations Act.
Dr. Bayeni, for many other unemployed doctors like Dr. Tapelo, are there any other reasons that the unemployed doctors maybe need to know that the department is doing to deal with this issue?
I think for one, we have been transparent in terms of representing or communicating with them through their representatives in the form of an organization referred to as SAMATU. As a result, even now at 11 o'clock, I am having a conversation with their General Secretary as well as their Chief of Staff from SAMATU. So one, we are constantly communicating with the unemployed doctors through their structures or their representatives. But the second one, we are constantly encouraging and talking to provinces to ensure that where they are having other means of communicating their available posts and adverts, let them do so that we don't only rely on print media or other structured ways of communicating the adverts. So as a result, there are facilities that have kept contact with their previous community services doctors so that whenever the advert is available, they are the first to be notified to apply. But the third thing is the guarantee and assurance that these adverts that have since closed now, there is an assurance that the pace of recruitment will of course be improved such that where we are able to start employing some of these doctors by February, we can definitely do so. And we are going to make sure that the adverts that are out, we do not leave posts that would have been filled and not filled even though they are funded.
Dr. Bayeni, we know that this problem, it's the kind of problem that South Africa as a whole is facing. Perhaps do you know any other provinces that are mostly affected by this? Hi, Dr. Bayeni, can you hear me?
Oh, okay. I thought you were asking from Dr. Mulot. In terms of the widespread distribution of the issue, of course, all our provinces, hence when I was quoting earlier on, I could give a sense of what we have received from provinces in terms of their responses. But all 9 provinces have got an interest to make sure that they appoint medical officers. And equally so, we have asked for confirmation, including proof of the adverts to verify the efforts that are made by each province. Hence, I could quote for you the 3 provinces that we have received confirmation from. And also, I can assure you that including Northwest, just 2 days ago, there was an engagement between the MEC, Samato, and the department to try and get close to a solution into the matter of unemployed doctors in Northwest. As a result, we will be hearing and getting the confirmation of the posts and the adverts that will be taking place in Northwest as of Friday, following that discussion. So there are numerous efforts that have been taking place, even at provincial level, because indeed the employer becomes the provincial Department of Health, as much as we are responsible and taking care in terms of the National Department of Health provision of health services in the country. But in terms of the employment and the structures that will be then giving those posts and advertising, it is at provincial level.
Just to go back to Dr. Molotsi, you've heard Dr. Bayeni's input in all this unemployment in the Department of Health, especially when it comes to medical doctors. Maybe you can just explain to us, how does this affect you individually?
It's devastating. One is used to be at work, to wake up in the morning, go help the people who are in dire need of our services. And another problem is sitting at home and people start asking, when are you going back to work? And that becomes a very difficult question to answer. Especially because even in our communities, there is a very huge shortage of doctors. People stay in the lines for too long, whole days. Sometimes people even spend more than 8 hours just waiting to be seen by a doctor because of the shortage of doctors that we have. So individually, I'm very stressed. It is depressing, and yeah, it's one thing that I think it is an experience that I would never want for anyone to have in the near future.
Hopefully, listening at Dr. Bayeni from the Department of Health kind of helped you to be maybe at ease and just hope for the better. Thank you so much, Dr. Mulotsi and Dr. Bayeni, for your input in our show, Pitso. Enjoy the rest of your day.
Thank you.
Thank you very much, and thank you for having us to clarify and make sure that we can bring some hope, not only to Thapelo, but to his colleagues as well.
Thank you so much. That was Dr. Thapelo Molotsi, a qualified medical doctor who is unemployed, and Dr. Luvuyo Bayeni, Chief Director for Human Resources at the Department of Health.